So the next topic is probably the most interesting one, at least to me, for the day. Artificial intelligence is already impacting our everyday life. We read something in FB, and the next time we check, the Google feed is tailored to our what we have just read. So it is natural that it should enter the medical field also. But will it be a servant or a master? Will it make doctors lose their jobs? Let us find out from the next talk. AI comes to healthcare, a friend or foe. I request Dr. Hariharan sir, Senior Consultant, PMR, KIMS Health, former Principal, Medical College, Trivandrum, to chair the session. Over to you, sir.
I must thank the organizers of this MEDICINA to give me a chance for chairing this session, especially artificial intelligence, and that too from my own specialty person, Dr. Ravi Sankaran. Ravi Shankar has been a promising, and he's also a promising physiatrist among all of us. I find a lot of new things from him, and he's working in Amrita Institute of Medical Sciences. His accent will be more American because he had his birth and everything from America. So I request him to speak in such a way that you don't make it your Kerala style, but it should be the American style. But it should be clear because this is a very new topic. Thank you very much, Dr. Ravi Shankar.
Good morning, everybody. AI is quite the buzzword nowadays. And Indian healthcare is not exactly perfect. We have problems. There's limited government spending for people. There's shortage of public facilities, so 2/3 of the population, maybe outside of Kerala, they don't get access to that great care. If you can't get public care, where do you go? Private, 4 times the cost. We focus on curing rather than preventing. So this means overall quality healthcare is unaffordable for the majority of people. Quality control is too hard for a country of our size. And eventually what happens is a young doctor sees all this and thinks, I'll go somewhere else, where I can be valued, not attacked, make lots of money. These are the problems we have. Of course, it's not just a doctor problem, it's not a patient problem, it's a government problem too. And the government has come back with mixopathy, right? And mixopathy is a problem, not only for patients, not only for us, it's a problem overall, right? So where mixopathy is a problem, AI can be a solution. And why? It makes care more accessible and more effective. What does it look like? Natural language modeled chatbots, where you can talk into a phone, the phone will talk back to you with medical advice. Telehealth, for personal touch, if you don't really believe what the phone is telling you. Alerts to clinicians, really irritating for us, but relieving for the patient to some degree. Automated dispensaries that can tell you what's being dispensed, where, why, how much. AI-guided surgery in real time. This is India. It doesn't work like that here. That's good for a European country, not for India. Right? You give a person a chatbot on a phone, they don't know what it means. It makes no sense to them. When things go wrong, they have to attack somebody. They have to break all their phones now and not attack us. Nothing stops them from telling us lies over a telehealth conference and getting a bad outcome and being angry about it. Munabai can break into the dispensary, steal all the drugs, and charge twice the rate. Right? We've seen all these things happen before. This is how our country works. Regardless, AI is coming. It's a bumpy road ahead, and we have to adapt to it. We can Swadeshi it, there's no problem, but we have to make it ours. Why? What is AI? AI is essentially computer systems designed to do, in some form, what we already do. How does it do it? Through haptics, video, audio, electrophysiology, inertia measuring units, patient-reported outcomes, biochemical things, events. What is AI good for? It's good for the things we can't do right now. finding unknown associations or patterns, combining large data sets and then comparing them to each other, integrating multiple variables to make precise decisions. This is a different level that we can't really compute on, but it can. AI has been in healthcare for about 20 years now. And the West has a lot of this, right? And if you look at it in dermatology, there's apps. You get out your phone, you take a picture. The picture will tell you you have skin cancer or not, until you get skin like me. And then it detects cancer over and over again. The European Union recently bought a chest x-ray bot. And this chest x-ray bot is going to read 1,000 chest x-rays in 1 minute. Of course, you still need a radiologist to check if it's done the right thing or not. And like Sir showed us, you can find all kinds of strange things the bot may not find. The engineers have found ways to diagnose sepsis from all the vital parameters we track in our ICUs. You still need a clinician to find out why is there sepsis and what you're going to do about it. It's not perfect. AI is more of a whisperer to a doctor. It gives suggestions of what can be, what may be, what you kind of missed, but it's not going to tell us what to do. Not yet. To really see where AI is going and how it's going to impact us, we have to look at a little bit of history. So in 1700, 1720, that's when electricity got mastered, right? And about 1956 is when the term AI was coined because they had computers. So natural intelligence and artificial intelligence, right? Of course, we couldn't see what the computer was doing until we got cathode ray tubes, and of course, that's our first televisions and monitors, of course, right? We got better processor speed, then we got solid-state drives, and now we have AI as we know it from about 2001 on. 250 years, roughly. Let's look at the time it took to reach for particular devices. Years to reach 50 million users. For a car, 62. Telephones, 50. TV, 22. Computer, 14. Mobile phone, 7. Facebook, 3 years. Facebook is so useless. Cars are so much more useful. 3 years versus 62 for a car. Now we're going to double that number to 100,000 and cut the time by 12. Uber, 70 months, Pinterest, 41, Instagram, 30, TikTok, 9, ChatGPT, 2. The more useless, the faster it gets, right? But this is how fast AI is growing, and now it has its eyes on healthcare, what we all do every day. The thing is, you can talk to doctors about all this technology, and some will listen. Most will say, I know patients better than this machine. I don't need a technology to tell me what to do. But it's still coming after us. It's still coming after what we do. So we have to know about it. So if you can't get a doctor to listen, what do? You show them who else is doing it already, and then they have to copy. So in Amrita, we are part of this kind of thing. I lead kind of the movement for this, and what we've done is I have about 3 or 4 active AI projects. We recently ran a hackathon. 50 people, AI specialists, mechanical engineers, and 30 physiatrists, where we sit together and try to figure out what we can do with technology to help people who survive a stroke and continue to suffer, right? As an extension, we've brought AI specialists to all of our doctors in Amrita and said, look, here's your old PG's thesis data set. Let's look at it and see what AI studies we can do with that. And that way, at least they're not falling behind. Reality is harsh. And technology just makes it all the more and more complicated, right? In healthcare, we're the ones with the fiduciary duty. We have to provide good outcomes. No one else does. If things go wrong, they're not going to blame the nurse. They won't blame a therapist. They're going to blame us. If healthcare was a car, the passenger is your public opinion, it's your administration, patients, blah, blah, blah. AI is great, AI is lousy, we're afraid, we don't know what it is. They're going to keep talking, whatever they want, right? We're the drivers. And the problem is because we don't really understand what AI can and can't do, we're blindfolded. Now, the problem comes to this car. The gas pedal is AI. You put your foot on it, it's going to jump. But you're blindfolded, you don't know what you're going to hit, or when you're going to hit it. I recently went to a C20, G20 summit on AI, healthcare, and safety. So it's about 200 AI people and 2 doctors, right? All these AI guys are deciding, should we have a break or not? You know why? Because they don't care. All they do is make something and show it off and get famous for it. We have to take care of the bad outcomes, right? So no one knows what the brakes are, what they look like, and they're deciding should they have brakes or not. This is someone else's life at stake, and if we don't get involved, it's quite the problem. Everything a patient gives us is data, from the history they give to the biochemical stuff, to the ECG, to the scans, and everything, right? Data equals database. Database equals artificial intelligence, machine learning, algorithms, which equals money, which equals power, which equals survival. The ugly truth about all of this. This is why it's running so fast, because there's something to be gained in it. Whenever I talk about this, people ask me, are we going to be out of jobs? Are we going to be not doctors anymore? Real stupidity beats artificial intelligence every single time. And if you look at the history of humanity, we're quite efficient at that. Meaning we've already won the war, we've beaten AI. It's just for us to figure out how to make the best use of it so patients can benefit and we can continue being who we are. It comes down to a simple attitude change. You know, a winner has a solution for every problem, and a loser has problems for every solution. AI is going to be a solution of some sorts. The thing with solutions is, every solution of a problem raises new unsolved problems. And who's going to be best to solve those problems? Us. We're the ones who take care of patients. We're the ones responsible. We had to get the job done. Not some AI guy sitting in a lab, not a nurse or a technician. The future looks like this. Doctors empowered by AI who can do more, and doctors who won't. There's a place for both, but one of these will become mainstream. AI is one of the biggest convergence-creating factors around right now. Healthcare once was. You have a problem, you go to a doctor. They use their knowledge and skills. Many of our teachers have been the greatest minds of their days. You learn what they say, you do what they say, you're safe, right? And we all know those people by name. But what happened is that knowledge and skill became more questions. That evolved into need for specialists. So now you have neurologists, neurosurgeons, cardiologists, etc., right? Where they're highly specialized in what they know. They were known by having big tests in technology, which is kind of generalized now. That led to super specialists who know even more about what they're supposed to do, but this is all focused on a disease, not a person. And this is kind of a problem. The super specialist is so good at what they do, they might not actually see the person they're treating. A person may get a trash basket diagnosis that makes them upset. So we develop systems, algorithms. A patient comes with this complaint, you do this many tests, you get that outcome, these are your treatment plans. Any fool can follow a system nowadays. And of course, because there's so much money in this, of course, there's managers, they have to make money too. But to fix this super specialist issue, we have multidisciplinary teams. All of this growth that we've seen in the past 3 to 4 decades has been led because of a knowledge deficit. We didn't know what we're looking at. We see something, we analyze it more, we find out more, we learn more. Knowledge deficit, right? AI is going to stop all that. If you look at Google's new AI that looks at an eye scan and detects hypertension, brain changes, that's leaps and years ahead of what we would be doing on our own. AI will bring us back to being doctors, people who have to be compassionate with the patients we take care of. And you'll get 3 flavors of doctor. Physician, the person who knows how to interpret what the AI says and then take care of a person and take responsibility for things that go wrong. A surgeon, highly skilled at what they do. They can do very good surgeries and take responsibility for the problems. And a physiatrist, someone who's going to take care of the person who goes through the system and still doesn't have what they want. It's not the strongest species that survives, it's not the most intelligent that survives, it's the most adaptable to change. And if we're not going to be that, someone else will pick it up and do it for us. If I haven't shaken you up and irritated you enough, I'm hoping some of you guys are interested in getting involved in this, and if that's the case, you wonder, how can I get started today? You all are big doctors, you have patients. Hopefully you all have a computer and you can enter data into it. If you have a little bit of free time, you can get a programmer, I can help you with that part, to process and the data through AI. And then at the end, you have to look back and see, does this actually make any sense? Is this AI putting out nonsense? Is it something meaningful? Is it helpful for patients? We're the ones who decide that. Questions?
Yes, open for interaction.
Hey, sir, was I slow enough?
Huh?
Was I slow enough?
No, very good, very good. Thank you.
I'm
Ravi
notorious
Sankaran.
for getting faster.
Yeah, your accent was followed by everybody. Things. So,
That's a wonderful question. So one of my friends is a lawyer in Ottawa, and he does exclusively AI stuff, and no one has any rules for it, which is why they keep on trying to get a doctor involved. Someone has to be the intermediary. If you look at CT scans and incidentalomas, right? When they came out, no one knew what they were. They start operating, they find out it's nothing. Who gets the blame? The doctor who operated, right? Same thing for AI. There's no real rules. The whole thing is legality involves punishment. Punishment means disciplinary action so someone learns from it. You can't put an AI in prison. It can't learn from any mistakes it made, right? But the person using it has to learn. And that's where the real question comes down to, is if the AI is right and the doctor is wrong, we know what it is, right? If the doctor is right and the AI is wrong, it's still okay. If the patient gets a bad outcome anyway, who do you blame? And that's what we do.
Very interesting. Thank you, Dr. Vishankar. Many devices comes today, they're saying it is AI incorporated. They charge 10-15% more than the select monitors, ventilators, everything. Is it a myth or a reality that that the concept of AI incorporation into these devices, is it true or?
There are many forms of AI. AI has been around since the 1980s. I know people who've made AIs that act like psychiatrists. Right? They just keep sending questions back and forth. So there's very low-level AIs that do work. It depends on how dynamic your data set is. So I work with a group in Hyderabad that does bionic hands, India's first, very nice hands. They have AI in the circuit board. How long do you need an AI to teach a person to do 18 grips? Not that long.
One more question. There's a challenge that all this data is taken from developed countries. And all this data which is taken by the AI is taken from the developed countries. There's no data from developing countries which is available for the AI analysis. So will it produce a scientific imbalance in the
Without
future?
doubt. We're not the same as white people in America.
Thank you.
yeah. Yes, we should give a good hand.
Thank you.
Thank you.
I request Dr. R.C. Sriyuma, sir, to present a memento to the speaker.